Good evening, everyone. It's 6 o'clock, and we would like to get our meeting, call the Community Mental Health Full Board to order. First item is adoption of the agenda.
Support.
Motion by Flynn, supported by O'Connell. Any questions? All in favor signify by saying aye.
Aye.
Opposed? Agenda is adopted. Next item is the hearing of the public. This is the opportunity for members of the public to address this board. You have 5 minutes to do so. Please identify yourself with your name and your address. And this board does not reply directly during this meeting, but if you need information, somebody will get back with you if you make sure you sign up on the sign-up sheet over there on the half wall. Is there anyone that would like to address this board?
Hi, my name's Alicia Oaks, and because I am a practicing attorney, I'm going to give my office address.
That's fine.
23550 Harper Avenue, St. Clair Shores, Michigan, 48080. I raised 3 kids that are not biologically mine, but for all intents and purposes, they're mine. I've had 2 of them for 6 years, and I've had the other one for 2 years. All 3 kids range with varying forms of mental health issues, one being very severe. He's been inpatient hospitalized 11 times. My family has been through a lot, and I want to say, quite frankly, the system fails our children. End of story. About 6 weeks ago, I went to Troy Beaumont Hospital with my 10-year-old who was kicked out of the face-to-face program. A week prior to that, we had went to the ER. He was approved for Safe House, which is a residential. It is not an inpatient. And he was put in the face-to-face program because they broke protocol and did not increase services when Safe House was not available. So he went to Safe House. Within that week, he got kicked out of our face-to-face program. He got kicked out of the face-to-face program, which required me again to ask attorneys to cover my court schedule so I could sit in an ER with him and get him evaluated. We were in the ER less than 22 hours. This is extremely important. He was approved once again for Safe House. 22 hours into our ER visit, the social worker at the hospital decided that my 10-year-old did not need any more services, and she withdrew the petition without asking for my authorization, without telling me that she was going to do so. And so at that point, I was left with absolutely zero recourse for getting services for my 10-year-old. I was sent home with him to deal with his aggressive behavior all on my own, with lies that his staff members would be out to my house that night or the next morning. And when I reached out to the staff, and I have all the text messages, none of those appointments were confirmed. In fact, one of his staff members was out of town, and she could not have ever made that appointment that the hospital told me that she was going to. And so I'm not sure how to fix the problem, but I am now on a mission to make sure that people understand what we as parents are out there dealing with on a daily basis, trying to get services for our kids. I have to say, in my 6 years of doing this, this is the first time that I'm not complaining about access. Access needs help, because usually the problem is getting services. In these instances, services were approved, but other aspects of the system are broken and causing us trouble. So I just want you to be aware what we're dealing with out there. Thank you for listening.
Thank you, Alicia. Did you sign in your contact information?
Yes, I did.
Thank you. Someone will get back with you. Is there anyone else that would like to address this board?
See which glasses I have on. I'm reading one. Hello, my name is Marcia Beaudry. I live in Utica, Michigan, and I'd like to introduce this young man with me. His name is Matthew Leahy. I'm his caregiver, and I've had Matthew over 3 years. And I'm concerned about some recent changes that were made to the community health. Matthew has a program director through JOAC, behavioral, but if you wouldn't mind, I'd like to just read it. It's not that long. Matt was born with a cognitive disorder behavior cognitive disorder. I'm here to give voice to Matthew's story and how the recent change on self-determination by Macomb County Mental Health is turning his life upside down. Matthew lost both of his adoptive parents and consequently went to live with his older brother so he could take care of him. He's unable to live on his own. Unfortunately, his brother passed away in 2016, and at the time, I lived at 139 South Wilson and here in Mount Clemens, and I worked at the Friend of the Court. I took Matt in on a temporary basis, but I had a roommate, and it was his house, so I had to move. I took out a small mortgage and bought a modest townhouse in Utica because Matt was in school in Utica, and he had a small job, and I didn't want to upset. Everything was all settled for him. The plan was for me to take care of Matt until I could no longer do that, giving him love and stability. Now with this change, which self-determination apparently has been discontinued as of October 1st, it's going to force all the caregivers to strictly work for agencies. This has made Matt's life and in future unstable. Why? Because the county is transferring our income to the agencies. And instead of making a modest $12.75 an hour, the agencies will pay caregivers minimum wage. It really saves the county no money, is my understanding, because it's just a transfer of wealth from the caregivers to the agencies. How can caregivers, or why would they want to work for minimum wage? To me, it's rather shameful. Caregivers must be trained, show compassion. It's a huge responsibility taking care of the handicapped, and they work hard and show great compassion. My understanding is only Macomb County is doing this. Macomb County is one of the wealthiest counties in Michigan, and I'm surprised they care so little for the handicapped that caregivers are not even given par with burger flippers at McDonald's, or even a car wash down the street is hiring in at $14 an hour. So, this is very upsetting to Matthew. He has a job and has been with me for over 3 years now. If the county forces me to give my wages to an agency, I may very well have to sell my townhouse. I am sure the other caregivers are also experiencing this trauma as well. That really digs into their income. This will pull the rug out from underneath us. I just pray that Matthew doesn't have to be forced into a group home. That would be devastating. It's my understanding this decision by Community Health will affect 1,000 plus mentally and physically disabled people in Macomb County. And I don't even understand how it will save the county money. Again, taking wages from the caregivers, transferring it into the agency hands. Quite frankly, from what I am hearing, agencies are not even taking any more clients. So how are they going to handle 1,000 plus? My question, why only Macomb? I think it's a decision that portrays Macomb County as rather heartless, that values the handicapped so little. I'm requesting that Community Health reconsider this decision, and I'm here on behalf of Matthew, caregivers who may have to leave their profession they love, and the ones that have no voice. Thank you for your consideration.
Thank you, Marcia. Is there anyone else that would like to address this board? Please step up to the microphone and give us your name and address, please.
Hi, my name is Lisa Gross. I live at 296 Euclid, Mount Clemens, Michigan. I'm here to talk about community mental health as well. I don't know what you guys think you're doing, but the math does not add up. Let me explain why my daughter is in self-determination. When we first got into the program, I was going through an agency. But because my daughter can be difficult, and I would have brought her, but she would have destroyed this room. And I can tell you, Lori Phillips can testify to that. She knows my daughter and has her whole life. So, I couldn't get help through an agency, so I was put on self-determination. which meant I could pay an employee $10.50 an hour. And I held that employee for 19 years until he had a massive coronary. Now, I just replaced my worker. It's hard to find somebody who'll work for $10.50 an hour, especially when you're dealing with a difficult child who is 30 years old and 6 feet tall. Now, I go and talk to my people who tell me self-determination is ending. You're going to have to go through an agency, which couldn't staff me last time. They're going to get $9.45 an hour, which means my current worker will not take the job. And I'm sitting doing the math, trying to figure out how you all are saving money. And I figured it out. See, the agency's going to take a cut. And if you're paying the $9 or $9.45 an hour to the worker, you're paying more for that agency to staff my child. They can't do it, by the way. The agencies aren't taking new clients. They can't staff the people who are waiting. So where is this money savings at? And then I figured it out. You all are hoping that all of us on self-determination give up, that we can't find staff, because we won't. And then you're going to look at us at our next review and go, you didn't use your hours, so let's cut that in half. All the while keeping your hands clean, going, we offered services. It's evil what you are doing. It is downright disgusting, because you can't tell me how the math works that going through an agency that's going to take a cut and paying my employee a whole $1.05 less an hour is going to save you money. You can't. What you're counting on is my daughter not getting staff. That's how you're going to save money. That's what you're going to do to all of us sitting here. And shame on you. I drove school bus at Macomb Intermediate for 21 years and would still be there, but I've had 2 heart attacks. I lift a child who weighs 250 pounds. I adore her, and she will be with me as long as I can keep her home. But you don't walk in my shoes, and I dare any one of you to try. Come home with me. She's eating spaghetti right now. Come on. I'll make you a plate. Live my life for 5 minutes. Any one of you, every one of you, come and see what we deal with. And then you're going to take away this minute choice I have where I can hire staff for $1.05 more than minimum wage. And you can't. There's no way the math adds up that you're going to save a dime. The only way you save money is for people like me to not use the service. And if that is the plan, you are evil. I don't know who's in charge of putting this grand plan together. I'd love to see the numbers. I don't like the fact that I heard about it on a grapevine. My worker has not contacted me. Everything's on the down low. But I've been a parent in Macomb County since my daughter was born. Parents talk. Isn't it a damn shame that I didn't hear from anybody here, or community mental health, or my worker, that I had to hear this from other parents? Because their IEP, or not IEPs, but yearly reviews came up before mine did. Shame. It's like you're doing something dirty and they know it. Otherwise, this wouldn't have been hidden from parents. I don't know what you want us to do. You don't have enough group homes. As that lady said, if there's 1,000 kids, where are you going to put them? Who's going to staff it?
There's 20 seconds left.
Thank you for your time.
Thank you, Lisa. And make sure somebody from the staff will get back with you if you sign your name and address. Great, thank you. Is there anyone else that would like to address this board? Anyone else that would like to address this board? Seeing none, we will move on then to our next agenda item, which is to approve the minutes from the regular board meeting that was held on May 22 of 2019. Motion by Phillips, supported by Fantuzzi. Is that one, Nick? Okay. Any questions or comments on that? All in favor signify by saying aye.
Aye.
Opposed? Minutes are approved. Next is approval of the standing committee meeting minutes from Program and Budget that was held on June 5 of 2019. Motion by Bush, support by Flynn. Nick?
Thank you, Mr. Chairman, Madam Chairman. There's one correction on the, I guess it's the third page of the minutes. It would be section 4F, the request to approve Macomb County Community Mental Health Web Development with increased design. I mentioned this to Lynn. She said she'd get it, and to you. The minutes failed to reflect the action the Program Budget Committee took, which was to refer it to, I don't remember who made the motion in the second, but Lynn, did you look it up for us? So just if we can include in there that the motion was to send it to the full board without recommendation.
Sure, thank you for pointing that out. So the minutes will be corrected to show who made the motion and who supported the motion to refer it to this full board meeting. So I would assume the motion stands as corrected. Linda? Yes. Okay, all in favor signify by saying aye.
Aye.
Opposed? Those minutes as corrected have passed. Next is request to approve PCE Systems Revised Electronic Medical Record Agreement. That was approved. We discussed that at a prior meeting.
Madam Chair, can I make a motion to approve 6A through
6A through
E?
E. Motion by Kraft, support by Bush. Any comments or questions on any of those items? These all were discussed and approved at our program and budget meeting and just forwarded here to be ratified. Seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item F, the request to approve Macomb County Community Mental Health Web Design Development with increased design.
So
You come up and, let's take a motion, then we'll get an additional report. Or do you want the report first?
I'll make a motion to approve.
Motion by Kraft to approve.
support.
Who said that? Support by Senior Material. Okay, please, go ahead. Please identify yourself for the audience again.
Hi, everyone. I'm Cynthia Robinson, Director of Communications for Macomb County Community Mental Health. I'm here to really answer any questions. I know we talked a little bit about it during the program and budget meeting, so happy to reiterate anything in regards to this project for the web development for MCOSA and for Macomb County Community Mental Health, along with Michigan Commonwealth and our intranet.
Yes, Linda?
I just have a question. I don't know if this is related, but I saw on Facebook that our logo has been changed. Was that recommended by Increased Design?
No, that was something that I did on my own with the support of Dave. It's something that we have been working on and put together. It was kind of a update for our social platform, but our full rollout for our brand and our updated brand standards will be coming out in late August.
And that's something Increased Design may weigh in on, the logo?
Not necessarily weigh in. The logo, it's kind of a two-part, so the design element behind the logo and the brand standards are being created by a designer that is working very closely with Increased Design. So that's separate. But the web development and everything that falls under that will be, taking under by Increased Design.
Thanks.
No problem.
Okay.
Thanks, Kathy.
Anyone else? I think the reason that it was sent here was just because it hadn't been on the previous agenda long enough for anyone to do some research. So, yeah, Commissioner Kraft?
Thank you. I don't have a question for you. I just wanted to mention real quick that within the last week or two, I've noticed a lot more of Macomb County Community Mental Health, kind of, maybe not necessarily advertisements, but kind of like advertisements on different web pages. So I've noticed an increase in our presence, and I'm guessing that has something to do with you, and I wanted to thank you for that. Thank you, Madam Chair.
Anyone else?
Great, thanks. Did you?
Okay, seeing no one else, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is receive and file. Are there any items that we have to receive? Nothing. Next is resolutions. We have two, and I will take them both. I'll take them each separately. First one is Catherine Munson from Access. Her the language is on the yellow page in front of you. Motion to move to approve by Commissioner Kraft, support by Schmidt. All in favor signify by saying aye. Aye. Opposed? Ms. Munson is allowed to retire. Then the next one is resolution for Commissioner Joan Flynn.
Support. I don't have that. Where is
Well,
it?
I'm sorry, we're not accepting that motion. I will read it.
Oh,
All right? It did not get printed ahead of time. It got printed way ahead of time, just for some reason missed distribution.
okay.
So in honor of her exceptional commitment to serving the community, mental health needs of children and adults served to Macomb County Community Mental Health, whereas for more than 25 years, Joan Flynn has supported the needs of those served by Macomb County Community Mental Health and Macomb County with passion, dedication, and unwavering determination as Macomb County Commissioner, Warren Crime Commissioner, Vice President of the Michigan Mental Health Association, Community Outreach Coordinator for the City of Warren, Board Member for Crossroads Clubhouse, and as Vice Chair and Treasurer of the Macomb County Community Mental Health Board. And whereas Joan Flynn has served as a true advocate for the people of Macomb County and the City of Warren, and whereas Joan Flynn has always demonstrated her efficiency and ambition in connecting and helping people in need, and whereas Joan Flynn is greatly admired for her strength and bold nature, especially when expressing her viewpoints, and maintains an infectious, optimistic perspective on life with the motto, always look at the good side of life, as her guide. And whereas Joan Flynn is extremely thoughtful and generous and will be remembered for her commitment to the people of Macomb County, now therefore be it resolved that the Macomb County Community Mental Health Board, on behalf of the Macomb County citizens and their families it serves, expresses its appreciation, gratitude, and best wishes to Joan Flynn for her exceptional efforts on behalf of community mental health and the people it serves, and wishes her continued success and happiness in her retirement. Be it further resolved that this resolution be spread upon the records of Macomb County Community Mental Health for all time, and that a suitable copy be presented to her as a testament of the high esteem in which she is held by the Macomb County Community Mental Health Board and the people it serves. And so,
I'd rather come up here and take front stage.
first of all, let me give you a hug and thank you for your many years, and we have some other goodies for you as well.
And you know what you always bought when you had to do the gifts?
So you get the box
Karma.
of chocolates.
Oh, the
Here,
roses.
and let's here, Lynn, hold that.
Yeah.
Let's look at Lynn.
Oh,
All right. And
I don't realize I do this many things.
they didn't even list them all,
It is,
Joan.
I know.
So we'd like to give this to you, and would you like to say anything else, or did we say it all?
You truly all will be missed, and a lot of you have retired. But I hear Lori's going to take over my position of collecting money.
Yeah.
So don't give her any hard time. And I'll still be on Crossroads because I represent the city of Warren for that, not mental health. And I've enjoyed my term. And coming up here, I thought this is the last time I'll be coming to this building for quite a while. I'll be going to the college.
There you go. Yep, wait, Joan.
More?
We have more.
I got it. Oh,
You couldn't make it to our Board of Commissioners meeting, so I'm here to present this to you from the Board of Commissioners. It's what Kathy read off, just a much larger version with
Well,
bigger
with a
print.
frame.
Congratulations.
thanks, thank you.
Tell her not to leave till we get her on the calendar.
I need to tell you where I put it.
Don't tell me
Oh, wait, let's get one with all three commissioners.
Yeah, we were all commissioners together. County commissioners.
County
Did I
Commissioner.
tell you, I found out that a county commissioner, I think I told you, is more important than just a trustee, because the county commissioners take care of the whole county, where the trustee only has the college, and the mental health board only has mental health. But your county commissioners are very important, so I hope they help you.
Thanks, Joe.
Yeah, thank you.
We need to set a date before you.
Oh, yeah.
Got it?
Oh, she-
Okay. Thank you again, Joan. I first met Joan when I became a county commissioner in January of 2003. And there weren't very many women on the board at that time, and Joan made a point to come over and talk to me and tell me all the things I should get involved in. And I actually listened to her, and then later went, what am I doing? She got me going on a bunch of different things, but it was all good, and it was all in an effort to help Macomb County improve its position in the community. So I can't thank you enough, Joan, for your mentorship and your wisdom and your assistance and loyalty. Thank you. Is there anyone else that,
No, I think I'll miss, but you know, I liked over at the administration building too. You know, we were more close over there, sitting in that small room. But, I've had some good times, I thought I'd come back at Christmas.
Of course.
Present got to-
Right.
very good. Well, thank you. Thank you again, Joan. We appreciate your many years of service to the community, and you're not done yet, obviously, so. All right, next is the voucher listings. Motion to approve the payment of the bills is in order.
Move to approve.
Okay, motion by Phillips, support by Burke. Any questions or comments? All in favor signify by saying aye.
Aye.
Opposed? The bills are ready to be paid, approved to be paid. Next, we have a request to approve the PCE Systems revised electronic medical agreement. I just flipped a page here. I just went, my thing slid down, so sorry. I'm thinking, why is that down there? We already approved that. Next is the management report. So, our director, Dave Pankatai, would you like to update us, please?
Yes, good evening, everybody. I have a lot of information tonight, so please bear with me. First, I wanted to introduce Adam Genovi as the new Deputy Director, Chief Operating Officer for Macomb CMH, to his first full board meeting, hopefully one of many. Also, so I don't forget, in your packet is some pink papers. The Community Mental Health Association of Michigan was kind enough to read your minds. At the last meeting, there was a question about the dues for the association, and what did they provide us in return? So at the conference, they had this set out, and they're like, you're probably going to be asked by your board about what do you get in return for your dues. So that's in there to answer those questions. I also had it copied, just informational. I'm trying to get ahead of Nick, so instead of adding things at the last minute to the agenda, I'll be giving you information early. This is the fourth amendment to our current contract with the state of Michigan. What's happening is the department is responding to a number of different waivers at the federal level. And in that exchange, the feds are saying, well, you need to do this and this, and it's causing the department to have to go back into our contracts and add information. So there's a nice red line version in this packet, which will show you the changes that they're making. And we can review this between now and July's program and budget. The one tricky part is they are asking for this to be signed and returned by July the 19th, which is before our July board meeting. I can call and ask for an extension. They granted the last one. I just had to explain our board meeting schedule. So that's informational and in your packet. Also at the state level, the 298 pilots have been officially postponed until October of next year. So they had been pushing to still start those. Saginaw backed out at the last minute, so there was the three counties that were involved. This is the pilot that's intended to give all the Medicaid funds to the Medicaid health plan in that region and have them coordinate all services. They weren't able to work out the funding model. There was supposed to be an RFP this year for a single PIHP to coordinate the behavioral health services for all of the Medicaid people in those regions who were not enrolled in a health plan. That was 66,000 people. That was supposed to be out in April. That never hit the streets. So it kept being delay after delay, and they finally just pushed the whole thing back until next October, but they do plan to continue to meet on it. I've mentioned to the board earlier about a new internal process called ROC updates, ROC meetings and stuff. A ROC is a special 90-day project that the staff will be undertaking. It's developed in the leadership team meeting, and then all staff are able to and encouraged to participate. We came up to our quarter end in June. We're going to do the final wrap-up, though, at the early in July, and we'll be starting some new quarterly projects. The three projects for the first quarter were pretty much determined by me. Going forward, they'll be voted on and decided on at the leadership team. The first area was crisis screening. We had been doing all of our crisis screenings by phone or electronically from the emergency department that the individual showed up at. I believe you do get a better and more specific screening when you do that face-to-face. So our ROC for last quarter was to look at how we could do that. Sheila Cote was working, and we started with children's services, and we were able to show almost a 70% diversion rate for our folks who presented in an emergency department. So out of 100 children, we were only looking to look for inpatient hospital for 30 of those kids. We are doing some year-on-year comparisons to make sure that was truly a significant change, and now we're looking to expand it to adults. The second one was our residential assessments. We did have a board study session on that topic, so we're looking at the individualized levels of care along with the supporting documentation for the residential sites. We will be starting some of those assessments and working with our providers in that area. So that one will continue, but good progress was made for our first quarter. The last one is why a lot of the parents are in the audience today, was self-determination, the use of fiscal intermediaries. There's 4 state-approved models of self-determination. It was never the intent to eliminate self-determination. If you've heard that, it's false. What we were looking at doing was changing the model through which self-determination is supplied from the direct employment model to the agency with choice model. We did meet with the staffing providers and to talk to them about taking on the additional roles of a fiscal intermediary. I then did meet with the fiscal intermediaries. I learned a little something in each of those meetings, and it was news to me about the pay differential between those two parties. It was a little different than anything I was used to. So what's happening is there's less administrative overhead at the fiscal intermediary side, and there's fewer training expectations for those staff. So they're able to transfer more of the rate, which is standard across our system, to the individual caregiver who's the employee of the individual being supported. So I was already starting to slow down and back off. The state of Michigan asked, they sent me an email, they said, Dave, we heard you're doing all this stuff, what are you doing? I explained it, and I quoted their technical advisory back to them, which stated I only had to offer one model of self-determination. The state responded by changing its technical advisory, which will be in our contract effective October 1st. I thought that was, points to them. So we are required to continue to provide the direct employment model to at least some of our folks. So it no longer reads one model, you have to have at least the direct employment model. There's a lot of technical benefits to the agency with choice model that benefit us as a funding source. It was never the intent to have people lose services. Actually, my thinking when I first started down this path was that we could change the model without impacting services at all. It wasn't until I met with the fiscals that I learned there is a difference in the hourly rate. It changes. Some people do get minimum wage. Some people get far above minimum wage on the agency side. But by and large and in general, the worker gets more per hour under the direct employment model. So we're backing off of that as a complete change. I will follow up with the department. I have some questions specific to the risk involved in the direct employment model. I'll be in Lansing next week, and I hope to get that on the agenda. And then there's some other kind of unique situations that are worthy of some additional follow-up. We were also not looking to touch anybody on the C waivers at the first round, if at all. So if your child's on the children's waiver, the SED waiver, or the HAB supports waiver, they were never involved. So I know there's some miscommunications out there. The update is on our website, and I printed that off and had some hard copies over on the counter over there, if anybody's interested. I wanted to make sure everybody was aware of the Metro Region dinner, which is scheduled for tomorrow at 6. Dinner starts at 6:30. We are hosting this time. It's at Villa Penna in the Angela Room. You should all have a handout. If not, see me.
That's for board members?
Board members and
Some
leadership
staff.
staff, yes. Thank you. I needed to touch on the July meetings. We are meeting July the 10th, which is Wednesday at 6 in this room, for the Program and Budget Committee, chaired by Phil Kraft. Recipient Rights Advisory, chaired by Selena Schmidt, will be Thursday, July 18th. There's no time on that, but I'm assuming 7:30 a.m. Yeah, those are always the early meetings. The full board for July will be Wednesday, July 24th at 6 p.m. in this room. And I think that concludes my comments, so thank you.
Dave, I have a question about the first rock. First, what is a rock? I know we talked about this before, but I also want to know what the context is of having 70 individuals not being admitted. That sounds like a tremendous number. What's that compared to without that?
I'm sorry, the 70 was my just example of,
Right.
out of a
It's set a
percentage of children.
right.
Right. Total for, it started April 15th and went through May. Yep. And we had about, Sheila will give you the exact numbers.
So we did about 33 screenings, and I'm forgetting the exact numbers, but I believe 23 of those individuals were diverted to a lower level of care. Or I shouldn't say lower level of care, different service delivery, yeah.
And our normal procedure, what is a typical percentage? How does this compare to
I
our?
think our current percentage is around 30% diversion.
Right. As a whole, that was children and adults.
That was children and adults, yeah.
All populations.
So this is almost double or more than double? Or did I misstate?
Correct.
I'm
Yep.
pretty confident that when we can get face-to-face screening 24/7 countywide, that we can approach the 70% diversion rate fairly quickly, and we'll be looking to do that.
Okay. Is there any follow-up to this? Are we going to plan this again? Or-
Yeah, this is.
Yeah, we're
this-
tracking all of the data. There'll be a presentation tomorrow evening at the Metro Region Dinner by
Okay.
my program supervisor, Terry Nakugar. So you'll see a PowerPoint presentation, and she'll be able to give you all the data tomorrow evening. So we're looking forward to doing that.
Wonderful. Thank you.
You're welcome.
Thank you, Dave.
Nick?
Dave, based on the comments at the hearing of the public, the correction of where we're going on self-determination, obviously, there's still a communication problem. And it sounds to me, just based on what I was gleaning, that there may be something even within our own staff as we're reviewing person-centered planning. Can you let us know what you're doing to try to correct that?
Yes, I was at the First Resource North this morning for a staff meeting. I'm working with Cyndia on our internal messaging and the emails. I have heard that some of the comments were made from our staff, other provider staff. Communicating in mass to our family members presents a difficulty. We did have, as part of the rollout, the community forums were planned. So I was meeting with the staffing agencies, followed shortly thereafter by the fiscal intermediaries, and then we're going to start meeting with the family members and the individuals involved directly. Because we had to stop what we were doing, we never held those community forums, and hindsight, probably should have, but we'll help get the word out as best we can.
And will there need to be some reviews of person-centered plans that happened in the interim area?
No,
Or-
nothing was changed in a.
So
in a-
nobody was actually moved off of the plan yet?
No,
And now they won't be as a result of your changing?
right.
Okay, thank you.
Okay, seeing no other questions, are there any other agenda items? This is the opportunity for board members. Any other questions or things you want to bring up? Okay, I have Joan and then Nick.
Could I just say one word? That I appreciate all the help I got from the staff. All my staff in the audience. Because it's been a long time, and the staff is the one that gets the blunts, even the director. Thank you again, everyone. I'll miss you. Bye-bye.
Thank you, Joe. Nick?
Yeah, as I mentioned at the last meeting, the Town Hall Alliance that we are part of continues to work at the state level. That was, for the members of the audience, that was a coalition that came together in opposition originally to the 298 proposal to take mental health services and put it in the hands of HMOs instead of CMHSPs. That had moved then to a pilot program. But at any rate, that group has essentially broadened its advocacy, as you might know, and our planning group meets every week on Monday mornings now. We are meeting, as I indicated before, on a sort of regular basis, roughly monthly basis, with the administration. We met last week with Megan Braun, who's the health advisor to the governor, and Sarah Epsley, who's the policy advisor, a policy advisor in the Department of Health and Human Services dealing with behavioral health.
Could I just get a point of information? When you say the department, you're talking about at the state level?
At the state
department.
level.
Thank you.
I'm sorry. Yeah, the Department of Health and Human Services, Michigan Department of Health and Human Services. So we met in the governor's office again, and this time we had 3 items on our agenda. The first was dealing with data collection, who's being served, who's not being served, and who's being underserved, and we continue to work at trying to clarify that. The department has the who is being served data in their computers, as Dave pointed out to me. Sarah acknowledged that. I thought maybe she was just having trouble. Sometimes you can, there was 2 ways to hide things, is not to tell people and tell people so much that you can't make any use of it, but she's got that more under control. There's a national group that our state association is working with to kind of try to extrapolate the number of Medicaid recipients nationwide, the percentage of Medicaid recipients who need mental health services, to kind of get an idea of the population that we haven't gotten to. And then the hardest part, quite frankly, for a variety of technical reasons, will be trying to determine the underserved population, and some of the people here in the audience are helpful at that with their comments and bringing that to our attention, as we have for years done through town hall meetings and so forth and so on. But we're trying to quantify that in more detail in order to develop a long-range plan to try to improve services. That conversation went on very well. We're moving forward with it. We were prepared as a group to make the arguments again about the mistake notion of the PA 298 original movement and the waste of money, in our judgment, of even holding the pilot programs, because there's a lot of lack of services. We know what the pilots are going to say because we've piloted the issue in the dual eligible population, which already tells us much of that. So we were prepared to make those arguments with the administration and the department, only to be short-circuited quickly at the beginning of the meeting by the department by telling us that they had removed the pilots from their waiver request because of the delay that Dave mentioned earlier. So one of our members wanted to continue to make the argument, and I said, we really don't have to do it now. We won. Take the win. Save the data in case it comes back, and it probably will come back, but save the data. But at least as of the day before our meeting, the evening before our meeting, the home and community-based waiver program, which had been submitted to the CMS at the federal level, had included the pilot programs. They had withdrawn their waiver application, removed the pilot programs from the waiver application, and resubmitted the proposal, which I think is really good news from the perspective of what this board has been advocating for some time. And then the third topic we discussed, because of the movement toward replacing the physical plant at Carroll Psychiatric Hospital and the thumb, and the discussion as to where, if it should be located in Carroll or should be located somewhere else, et cetera, was our advocacy for additional hospital bed availability. We've been arguing that you need to replace Carroll. The physical plant needs to be fixed, but you also will need some additional hospital beds in the public sector because of the problems we've had with getting sufficient treatment, or because of the inability of the hospitals in many instances, or unwillingness because of payment reimbursement levels, to handle some of the most serious cases. So that continues to be a topic of discussion. The administration indicated generally that they, as Dave indicated, they indicated that they agreed that we couldn't get the PA 298 pilots up and running if we wanted to, and I think they're coming around to the idea that maybe this isn't really the direction we should go. They do acknowledge that there's need for additional hospital beds. Of course, that's cost and money issues that are long-term and that have to be looked at. So we'll be continuing to meet, and it seems to be a productive set of meetings.
Thank you. Anyone else?
One more thing. I meant to mention, I also did, I think Linda had asked me at the last meeting about where we were going on legislation in general. The chair and I, chair appointed me chair of the legislative committee of this board, and with the intent of trying to reinvigorate, revitalize that. I have had a conversation with Al Lorenzo. We're going to meet Al Lorenzo, Marilyn Lane, who does a lot of the interaction with the legislature, and I are going to sit down within the next week or two to just kind of compare notes, and then we'll be calling a meeting of the legislative committee to try to put together a legislative program. But I wanted to make sure we had input from the executive's office and find out what resources we would be able to tap into with Gary Owens, who's the county's lobbyist, and others. Owens, I'm sorry. So those of you who are members of the committee anticipate that we will have a meeting sometime, probably in July. We're meeting in early July with the county administration.
All right, thank you. You didn't set a date. No date has been set yet. Anyone else? Seeing none, I'd like to make a comment. Linda Bush and I took up Sean on the invitation to visit creative employment opportunities. So we met them at their Anchorville facility. Had a great time. Met their dedicated staff and people they serve, and had an enjoyable time. And we are invited to their open house on Friday, this coming Friday, at 15 Mile and Harper at the office there. That's from 10 o'clock until 1, is that correct? On Friday. Sean maybe will tell us some more about that. And then before we go to the hearing of the public, I would like to read our mission statement. I neglected to do that when we started our meeting. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. And now we'll go on to item 12, which is hearing of the public. Is there anyone else from the public that would like to address this board? You have 5 minutes. Please give us your name and address.
Hi, my name is Anne Marie Foxworth. I'm at 15474 Haverhill in Macomb Township, Michigan. And first of all, I would like to thank the board for addressing the issues of the model for self-determination. And I would like to ask you, as you continue to review this process, that you would give stakeholders a voice in this process. You do have a current committee that is the PASS committee. It is a Partners Advancing Self-Determination Committee that has been meeting all of last year and is still meeting this year. And they are different stakeholders, different people, MISDs, your caseworkers, stakeholders, different members on that committee that could help you as you review this process. Part of that committee was to review Macomb's self-determination process and how it can be enhanced and improved. So there is a committee already in place that could help you, that have stakeholders. And again, I thank you that you addressed it here. I look forward to still hearing more about this and how you're going to progress with that. Thank you for your service.
Thank you.
My name is Maureen Kiak, and I am a parent, and welcome, David, or Mr. Pankratine, sorry. Welcome to the board. My son received services, and he has for 18 years. So, and thank you all for addressing about the C waiver, that there's not going to be any changes. What does that mean for changes for the adults that are on self-determination?
Just thank you for coming here and asking these questions. As I had stated before, you may not have been here yet, but we do not reply directly during the meeting. But there is a sign-up sheet on that half wall over there, and if you please sign up there, we will get back with you. But we'd like to hear what your questions are. We just won't take the time now to answer
Got
directly.
it. I apologize, I got here late.
That's okay. Could you repeat your name, please, the
Maureen.
secretary? Maureen?
Yep,
Thank you.
Kijek, K-I-J-E-K.
K-I,
Yeah.
all right, thank you.
So, and yeah, I mean, I had a bunch of things that I was going to say, and then apparently coming in, I got the information that that has now been on hold. So thank you again for your consideration for that. And I like the part of the informed choices of the people we serve as part of your mission statement, and the self-determination group that she spoke of. So I would just also again urge you, like probably everybody else will, that we parents, we stakeholders, we parents, friends, everybody, we can help you. We want to help you. It's our passion, it's our life, that's all that we do. And everyone is all in the same thing. We're all fighting the same battle. Everybody behind me and everyone who couldn't come is fighting it so much more desperately than you even understand. So thank you for your time.
Thank you.
Hi, my name's Carolyn Gamicia, and I actually have a packet for everyone, and is it going to cut into my time? Am I passing them out? I don't know. I will start to address this. My son is a recipient of services from Macomb County CMH, and he has been since he was 5 years old. He will be 28 years old on July 1st. So the reason I'm here is as an advocate for our son. He currently is in the hospital getting an IVIG treatment that takes almost 20 hours and costs $20,000, which he receives every month. During the cut in his services, that was not a consideration. His medical health was not a consideration. My husband, who is currently with him, we started our day today at 5 o'clock for an admittance at 8 o'clock. My husband, who is currently with him, is a police officer. And I want you to know that the county cut our respite services to 0. 0 from 50, and our son has a HAB waiver, which is indicative of ICF care as a much higher need individual who also has autism, epilepsy, and we have 4 letters from his medical providers that stipulate he needs 24/7 line of sight supervision. And as I said, my husband's a police officer. There's times when he would work an 18-hour shift. I had already been up 24 hours with our son, and he would have to then assist our son and ensure he was safe and ensure that his health and wellness was being provided for. This cut came after we waited to go to an administrative state hearing. We waited for 5 months for the hearing process. The judge overturned the denial and decision, and Macomb County, within 10 days, cut his services to 0 and told us that during the hearing process, we could not have any hours of respite, which was a violation of his Medicaid the denial letter indicated he could continue his services. We asked they be continued, we got 0. When we went to the local hearing, which we are now forced to do, they indicated that my son was being staffed by 3 full-time individuals via CLS. That was not the case. At the time of the cut, he had 42 CLS hours per week. That does not add up to 3 full-time employees. So I'm here to say one of the basic rights of families in this county is a respite. So what I've provided you is the testimony that was provided this week to a Senate or a House hearing on a federal level to our House representatives in a national hearing that occurred on Tuesday, June 25th. The hearing was before the House Subcommittee on Health, Energy, and Commerce, and the hearing was reauthorizing vital programs for American families. This testimony was provided by Jill Kagan, who is the director of Arch National Respite Network and Resource Center. I'm not going to go into her testimony. I've provided it for you. It is indicative of why families need respite services. Also, HR 2035 is a national act that provides the funding for these services. I would like you to read the documents that I'm providing you, because these are the appropriations that fund our respite for families like mine, even though we were denied, hers, and anybody else here that's a parent. This county now has on your website, and we have provided this during our hearings, this is a executive directive signed by John Kinch last year, limiting the number of respite hours, tapping it off at 22.5 hours. That's a violation of Medicaid. And I don't know how this this executive directive went through, but Medicaid provides that you look at a person's person-centered plan, that you look at the person, you consider medical necessity when you do that, and that you determine if you're going to cut a service, that the person gets due process. Our family, was denied due process. I'm asking you also to review this directive, because when we went to hearing, Mr. Panikai also gave us a directive from January I don't know if it's been approved, I don't know if it's not on the website as an executive directive. It was dated in January. We were handed it in a meeting that we were going through on hearing. We've been in hearing also for 2 years on different things. Cuts, reinstatements, cuts again, reversals by administrative tribunal judges that this county does not honor. Right now, we'll be paying an attorney to go to show cause, but my son is being denied in his enhanced pharmacy that he's gotten for 8 years. It's being cut as a self-determination service, Mr. Camerata. So yes, there are people getting self-determination services that are being denied that service. Right now, that's happening. So I've provided you the law, the act that's going to be reinstated on the federal level that this state can get funding from. And there's explanations of all the states that are being provided those funding, 36 out of the 50. It's something that we've advocated for in the state of Michigan, for families like ours to be able to respite. Our son really only had 50 hours, so that's not even 2 hours a day for us to be able to sleep and have a person come in our home and have us be able to sleep, maintain our own employment. My husband to be safe when he goes out in the community on a 12-hour day as a police officer. He's been doing that for 34 years, a public servant, a first responder who's exhausted now. He's in the hospital with our son. He's been up for almost 48 hours. I came here today because it's important for me to be here, and I appreciate all of your help. I appreciate all of you sitting on this committee, because I can't imagine it. It's got to be hard when you hear our stories, but we're here to tell you because someone said it was evil. I don't think it's evil. I think it's deliberate indifference, which creates a liability for this county, a legal liability. if something happens to our son and her child and her child. So that's why I'm here, not only for our son, but everyone getting services in the 925 people under self-determination contracts in this county. Additionally, I want you to look at a compliance memo I gave you a copy for. This is on the website as well. It was drafted by Kimberly Cope. It was handed to us when we were in a hearing for something else the day before it was to take effect, which would have changed our son's services under his person-centered plan, his individual plan of service, a skill that was taking him over 2 years to obtain, to be able to go into the public, buy his own vitamins and mineral supplements. As I said, this is a young man that's getting a $20,000 infusion as I stand here. His health is that compromised. You denied him the right to be able to do that and go in the community because of this compliance memo that actually, if you read it, and there's a DO on here, as you as a doctor, please read this because it's not implementable. It addresses the formulary in the state of Michigan under Medicaid. Vitamins and mineral supplements for people under the HAB waiver aren't provided under Medicaid under that formulary. The FDA, as mentioned in the compliance memo, does not oversee vitamins and mineral supplements and regulate quantity, dosage. You should know that as a medical professional. I know that as a mom. The nurse that signed off on this memo, I guess she didn't know that. That's why I'm bringing it to your attention. It's a liability for the county. I pay taxes here. If you're going to go and somebody's going to sue you on this, it's going to cost a lot of money for an attorney to be able to defend this compliance memo. As I said, it was handed to us the day before our son was supposed to start getting services from a pharmacy that Mr. Panikai chose for our son.
Carolyn,
He wasn't allowed to choose.
I want to thank you for,
I have one more thing. I would like you all to learn about self-determination. Tomorrow there is a webinar that Wayne State University's Developmental Disabilities Institute is hosting. You can learn about self-determination because when I watched last July's meeting, when some people presented on it and I heard the questions, it was obvious a lot of people don't understand the philosophy and the practice of it and how people are supposed to get it through their person-centered plan and through their individual plan of service. And I thank you. If I feel or sound frustrated, it's because we are doing the work. The parents are doing the work out here. We really are. We're doing the advocacy. We're trying to ensure there's appropriations for these services. We aren't asking for more than what we need, but our children are deserving of it. My son, before 2 years ago, was an example of the success of what we did in this county for people that were getting services. Up until 2 years ago, he was a model person that you could put up there and say, his children's waiver, his HAB waiver made it possible for him to lead a full life. Currently, that's not happening, and it's affecting our entire family. So I just want you to know that, and I appreciate all that you do. Thank you.
thank you very much.
I know I already spoke, but I also know I didn't use my entire 5 minutes. My name's Alicia Oaks again, and I just want to address something that David said. David said that there's a 75% of people receiving less services. Here's what I would like you to consider with that number. Number one, my son is part of that 75%. He didn't go into the hospital. What happened? 1 week later, we were back. So I want the answer at a future board meeting of how many of these people that are being given lesser services end up back at the ER within a reasonable amount of time, let's say 30 days, asking for more services, because I guarantee you there's a number there. I guarantee you it's not 1%, 5%. My guess would be you're probably looking at 25, 30, 40% just based on my experience as a parent in the ER. And you see the same families, you see the same kids. You get to know people, and actually, quite frankly, it's your lifeline because you know somebody else is going through what you're going through as well. And so I really would like to know that answer. And then in addition to that, I want to say that the crisis line has been great, other than the people who answer the phone. When you're in crisis, you don't need 500 questions, you need to get through. And so I want to say that the people that come to my house, Roxanne, Nancy, Dee Dee's been to my house, Sharna's been to my house, they have all been great. They come in and they stop me from having to take my son to the hospital many, many times. So that is a service. Now, both times I can tell you that Roxanne and Libby were at the hospital one time with me, and that Roxanne and Nancy were at the hospital in those 2 weeks that I had to take him back to back. Both times they recommended Safe House. Both times Safe House did not have a bed. So the first time, instead of increasing, which is what protocol calls for, I was decreased to face-to-face. Now, I can tell you my son's done face-to-face 7 times. It doesn't help him. Quite frankly, when I took them there, they said they can't help him. I already know that. Access should know that. They should be looking at charts and seeing what these kids have done before and what has worked and what hasn't worked. And then to have a social worker just withdraw the petition, and that's what happened to our family. And when the social worker withdraws the petition, I don't have a right to appeal as if Access would have made that determination. Believe me, I spent numerous hours on the phone with the supervisor at Access, who assured me at no time did they deny my son's services. They wanted him to stay at Beaumont until there was a bed at Safe House because they knew that what I was dealing with was a severe issue. And so leading up to these events, he caused $1,000 worth of damage at school. They had to evacuate a school building because my son was throwing scissors at students. Do you think I want to stand here in public and admit that these are the types of things I deal with on a daily basis? No, I certainly don't. But all that damage that he did, they wanted him to get help because he had recently been in Kingswood and they readdressed medication issues. And it was a medication issue. And after the second ER visit, his psychiatrist, Dr. Riolo, who I want to give great compliments to because she really takes the time to explain things at Judson Center to the family, she made more medication adjustments. She tripled the dose of one of his medications, and guess what? We're not having scissors flying through classrooms right now. And so the social worker, who in her clinical impression never spoke to my case manager, my peer support specialist, his therapist, his psychiatrist, the behaviorists that come to my house, never spoke to not one member of the team, but this social worker decided that because we had been in the ER for 22 hours and there wasn't a behavior, that he could just come home. Well, let me tell you, he came home, there were holes put in my wall, there were bruises put on my 7-year-old daughter because he was still aggressive, but it didn't lead to the aggression that would require taking him to the ER. And so I'm just asking that if you're going to be running those numbers, that you truly consider how many people are ending up back in the ER after that, and are they getting the services that they're told that they're qualified for when they're there. And I don't blame the staff that comes to my house, because I can tell you that the staff that I work with is great, and they really do care about my kids, and that they will answer a phone call at 9 o'clock at night or tell me what or where I should be going when things are happening. And not one member of his team felt like he should have come home that last time we were at the hospital. So I want to thank you all for listening to me, and hopefully together we can make some changes that will truly benefit our kids, because I do think that the mobile crisis coming to the hospital has been a good thing, because they can put words into parents' mouths that they can't do themselves. So thank you. Have a good night.
Thank you, Alicia.
Hi, my name is Rebecca Wilson, and my address is 25861 Norvell, Chesterfield, Michigan, 48051. I know you can't answer or reply back to me, but I don't know if we can do a show of hands. How many of you have children? Is that allowed? Not allowed?
Not allowed.
I guess my question to you is, imagine not being able to just be a parent. You're constantly advocating for your child. It's on a whole different level. It's something that I don't wish upon anyone, and we depend on you to help us. So I think overall the consensus is that we need you to fight harder. We need you to understand what's going on. As some parents said that there might have been issues with some people understanding what self-determination is. I would stress to you, as a board member, unfortunately, you take on that responsibility. That's your responsibility. Every agenda item that's brought up, you need to understand what it is, how it works, and how it affects everyone else, all of your consumers, all the people that you deal with. That's your responsibility as a board member. I don't know how many of you are aware of it, but it's a legal responsibility of what you're supposed to be doing, understanding, and the job you're supposed to be fulfilling. In that respect, I just have a few questions, and I know you can provide answers to them. I have been talking to a few people myself and just kind of information gathering. I don't want to bash anyone. I just want the information. I am also a parent of a child on the waiver and have been receiving services probably for about 3 years now. One of the issues we're seeing right now is impromptu. Our caseworker was taken away from us. This is someone that we've had with us since the beginning. We now have a new caseworker who called us, and not to her issue, but she can only meet on certain days at certain times. Well, I work full-time, unfortunately, and my child goes to therapies every single day of the week. And for the caseworker to be there, the child has to be present for, I believe it's 15 to 30 minutes. Well, now what do I do? How do I get a caseworker to my house if I'm restricted on when they can be there? These are some of the issues that are going on, some of the bigger picture items that I wish you could fully understand, but you can't. You really can't unless you're in our shoes, unless you're seeing what's going on a daily basis, on a regular basis. And I say this, and I'm trying not to get emotional about it, because right now it's not emotional. This is a job for me. This is a job for me to advocate for these children, not just my child, because as you said, the waiver may not be affected right now, but in 6 years, my child's going to age out of the waiver. Then what do I do? I mean, he's already 12 years old, 90 pounds. I have arthritis and lupus, and there's going to come a certain point where I'm not going to be able to do what I need to do. So we count on these. So my ask, I guess, in this instance is the transparency, and I've discussed it with some of you. I know you say you are, but you're really not, in that you're in the plan of making certain decisions that affect so many people, yet you are so few people. You are representing such a big picture, such a big population, and what you decide and what you do, whether it's passed down from the state or anything else, impacts at a whole nother level. And I want you guys to take that as seriously as it affects us. And I know that you said there's nothing happening, and there's this October 1st deadline, I know too, with the budget information. So even looking like at the website, there's things like all of the 2019 skills training for CLS, respite, and SD staff have been canceled for the rest of the year through Macomb County. Why is that? If there's no changes to the self-determination aspect, or at least through the FI, because that's a requirement. Your staff has to have that within 60 days of starting. So at this point right now, no one can have any new staff. Right. No one. That's an issue. It's been canceled as of July through the whole rest of the year. That class has been canceled, and it's mandatory. So that right there tells you that no one else can implement anybody else. There's no new staff. I also received word, and maybe it's not true, that none of the FI contracts have been renewed yet. And that deadline may have already passed. So that's another question. I don't know when they are normally renewed, but apparently none of them have been renewed. The other issue, just with the agency with choice, and I understand, and if you can make it work, kudos to you as far as staffing and everything else, because everyone that I know that deals with the staffing agency has nothing but issues, unfortunately. Getting good staff is normally predicated on paying them a certain amount of money. I would encourage each of you to, one, go with a caseworker onto a case and see what a parent goes through. See what that caseworker does and how many cases they have to see and what they're responsible for. I would urge you to do that in that respect. I have many people that would voluntarily have you in their home to see what they do with their child or how they have to interact on a daily basis to do that. You know, I guess in the long term, if it's a training issue or if it is a support issue, then where do we need to go with that? We need to better train, whether it's the FIs or the staffing agency or the caseworkers, because another issue is getting the same information across the board. Whether you call someone at the county level, whether you ask your caseworker, whether you ask someone else, I will guarantee you will get a different answer from all three people. And that's a huge concern as well. Just the main fact of being able to have the consistency across the board in what we deal with, you know, the transparency issues of giving people even a heads up, this is what we're thinking, and this is why. Your consumer, I think, would be much more receptive. Well, one, if it has nothing to do with the budget, would be great, but telling them, why are you doing what you're doing? And I know that you don't have to do that, but I think it would be a game changer for you guys, just to have that transparency with the people that you serve would be a huge, huge step in the right direction. I mean, and so overall, it just, what I began with, I'll end with, is that we need you guys to fight harder. Thank you.
Thank you, Rebecca. Is there anyone else that would like to address this board? Seeing one, while he's coming up here, I would just like to remind people, if you've spoken tonight and would like a reply, to make sure that you've signed in at that half wall by the door here, and somebody from the staff will get back with you. And thank you all for being here and advocating. Sean.
Thank you. I'm Sean McGregor. I'm with Creative Empowerment Opportunities, just here to give the monthly report. CEO hosted the annual 4th parking lot show, May 24th. The individual served monthly seminar was on severe weather safety, which I have a packet for. For our community center update, our Clinton Township location has started a new Adapted Life Academy for individuals in recovery from mental health issues. They will be using greater community to teach banking, shopping, laundry, and transportation skills. The community center has been offering greater community activities such as parks, museums, and also toured a local radio station. There's been 3 new individuals that have just started the program. The community center also received a new barbecue grill and has planted a few garden boxes. Additional quotes have been added to the Snowzillion room. A new micro business called the Forever in Bloom is in the process of development, which is what I brought with me today. At our Anchorville location, we hosted a tour of the community center on June 20th for CMH board members Kathy and Linda. Thank you for coming out again. The program hosted a memorial luncheon to recognize the loss of 2 friends who've recently passed away. Friends and family were invited. Everyone had an opportunity to express how they felt and share stories. The community center has also planted vegetable pot gardens and rearranged their gardens. The outside sitting and smoking area was updated, and as well, we have another monthly micro business. They made 4th of July flag pens and sticky notes as well for everyone. Our Mount Clemens location hosted a picnic in which everyone received a free hot lunch, that played games and socialized. The center classroom was also recently repainted. Individuals served enjoyed a variety of activities in the greater community, and the parking lot was repaired and resealed. Individuals have been engaging in greater community activities by attending creative academies. Our Washington Center has been busy going to the DIA historical museums and local parks, in addition to volunteering for Meals on Wheels. The average daily participation for the individuals is on average 50 to 60% per day. The community center is hosting a relaxation date night fundraiser basket in support for the greater community activities, which I have a flyer for everybody. For our stakeholder update, thank you. For our stakeholder update, CEO will be hosting the annual Country Picnic on June 28th from 10 to 1 at our Clinton Township location, which Kathy did mention. The event will provide lunch, petting zoo, karaoke, and talent show. Please join the fun. As well, CEO employees retention rate for May was 96%. And just as a final note too, personally as well, it was really nice to see all the parents and or guardians coming out tonight in support of their children. It's always fantastic to see. At the end of the day, I think we're all here to serve our individuals and or children. Thank you to everyone.
Thank you very much, Sean. I'm sitting here and gathering all this good stuff. Is there anyone else that would like to address this board? Seeing none, we will move on to item 13, which is adjournment. This meeting is adjourned. Thank you, everybody, for being here.
Madam Chair, I requested my name. Is that okay if I take it?
Yes.
County Farms.